you have any idea?
If I which isn't bad, but it's
Give it a try, right?
usually anytime you don't get the doctor you want, and I wish they would have the perfect people. So that doctor is better, but you can't have them because it's not ever. Nutrition 3 times a visit.
I guess I will turn the lights on for a second.
Okay, and you said we were supposed to have like a video or something, right? Okay, good. 'Cause I found something super cheesy to say.
Did you say something stupid?
I said something cheesy, but
Oh, it's fine. We don't cheese. Cheese is alright. Everybody will wake up.
yeah, I'm good.
Okay. Good deal. Take notes as you wish.
Okay.
Write down your question.
I'm gonna make this like have volumes.
What?
Volume.
Volume is down below. And it's
Something
off.
different in here.
It's off. So I'll turn it on right here. Over here is a big button. I don't know if you can see it. What's up? You should be able to hear it.
Oh boy, that didn't.
Hey, oh.
Yeah.
Alright, pay attention.
The doctor is my health protector, and he makes me laugh.
Your doctor makes you laugh.
Breezy Buzz, you can go in now. I don't want to go there. Breezy Buzz, you can go in now. I don't want to go in there. Now, just hold your horses. Going to the doctor can be fun. The doctor is your health protector and can make you laugh. The doctor can make you laugh? Why, you look sick. Let's see what we can do for you. Remember, your doctor can be funny, smart, and a magician. But most important, he'll make you feel better. The doctor is my health protector, and he can make me laugh.
So that just happened.
We like it. Everybody likes that. Come on.
All right, so I did traditional and non-traditional healthcare, and basically the topics that were in this chapter were the types of healthcare, like healthcare tests, like whether it be at home or going to a doctor, oral health, pretty self-explanatory there, and health consumption. All right, so the types of healthcare are traditional and non-traditional. That's the title of my chapter. Traditional healthcare is basically like you go to the doctor, they give you medicine, and they try and fix you. Non-traditional is kind of like your weirder, not always weird, but like that would be the easiest way to explain it. Is it's not your normal ways of, I guess, treating your illness. And so, like I said, traditional healthcare would be like going to a doctor, a dentist, a physician, something like that. And then some examples of non-traditional healthcare would be like acupuncture for back pain. They use it for many different like pain relievers and stuff. And I guess everyone knows what acupuncture is. It's where the stabbing of needles, basically. And then it said one of them was nature therapy, or whatever, and that's basically where you just use natural remedies to try and treat diseases. And the other one I'm not even sure how to pronounce, but it said it was a traditional Indian medicine discipline. And They use herbs as medicine and proper nutrition to manage conditions. Monitoring your health at home. Some things that you can monitor of your own health at home would be pregnancy, fertility, blood pressure, cholesterol, colon cancer, urinary tract infection, and HIV infection. Basically, the book talks about how you don't have to go to a doctor to make sure you're healthy. These are like examples of things that while you're at home you can kind of check yourself before maybe going to a doctor if necessary. These are things you can kind of like monitor on your own time, that you don't have to constantly be at a doctor wondering what's going on with that. Some things with the common medical exam. Basically, what it was saying was just your common things that when you go to see the doctor they do, and that would be like when you first get to the doctor and they check like all your stuff, like your vision, your ears, when they have like the stethoscope and they check your breathing and they make sure like all your joints and stuff are moving well. That's basically what they were talking about for that part. Oral care is pretty self-explanatory. That would be like brushing your teeth. It's said to use toothpaste with the 8A seal and soft bristle toothbrush. You should hold the toothbrush at a 45-degree angle to the gums. Floss daily, visit the dentist twice a year, and make sure people who are working on your mouth are wearing gloves. So otherwise that'd be kind of gross. Alright, and then it talks about gum disease. And gum disease is basically plaque lives under the gums and may cause gingivitis. And then a big word that I'm not sure how to say. Some symptoms of gum disease are bleeding of the gums, redness, puffiness, pain, bad breath or taste, receding gums, and shifting and losing teeth. Other risk of gum disease: it gives you a higher risk of developing heart disease, premature births, respiratory disease, stroke, and uncontrolled diabetes. And then healthcare consumption was basically about where you can go to get health care. So like you have your outpatient treatment centers, your hospitals, maybe it's private or public, academic medical centers, emergency services, inpatient care, and home care health care. And home health care is basically like if somebody comes out to your house and does your medical stuff for you. And then it kind of covered health insurance, but not really at the same time. It like was in there, but not a whole lot of detail about it. Basically, it said managed care is the predominant form of U.S. healthcare. So that would be just like you having your own healthcare provider. Preferred provider organization, third-party contracts provide the service. Basically, what that meant to me was like your company provide your healthcare, like wherever you work is providing you with your healthcare. And then Medicaid and Medicare is the federal and state insurance plan for the low income. So that's kind of like the whole, I guess that kind of covers into the same thing as Obamacare, which is going on right now. So it's like the federal government paying for your medical insurance. And then health maintenance organizations, which I'm not 100% sure what that was even about. They don't really give a whole lot of detail on that part. It was just like a short little section of it. And then the book also had a little "Are you a savvy healthcare consumer?" quiz that I printed out for everybody. So. There can be. Alright, so on the "Are you a savvy healthcare consumer?" It's got, well, that's confusing. 10 questions. Basically, asking you about how you do your healthcare, and you're gonna go through and answer each question honestly as possible. And then on the back, at the bottom, it has what they consider the correct answers. So, if you want to go ahead and fill that out, and we can go over it, I guess.